Daniel Gillman here with College Town at the 2026 NCAA Convention in DC. So happy to be joined by the NCAA Chief Medical Officer, Deena Casiero. Deena, thank you so much for joining us here. In 18 months in the position, I guess I'll start with a bigger question. What have you felt like you've kind of achieved in the last year?
Yeah, first of all, thanks for having me. It's excited to be here. I think for me, it's been about a chief medical officer who has been boots on the ground in the membership. I've started off my career as an athletic trainer and then went on to become a team physician for the majority of my career. And so I think just bringing that perspective to the membership of having sort of lived in their shoes and sort of felt and seen what they go through, I think that's really helped SSI to bring a different perspective on how we approach our work.
You talk about the Sports Institute there. The Sports Science Institute hosted the convention meeting here, the session on student-athlete health. What do you feel like were the key focal points of that conversation?
Yeah, it was a great session. I was really excited about the panelists that we had. We had a team physician who I've known for a long time, primary care sports medicine physician, Margot Patsukian, and Tim Coffey, who sits on our committee on competitive safeguards and has been working with us through our performance technology efforts. So I would say the session hit on a ton of different topics. Performance technology, certainly one of them. We talked about the statements that are about to be released for the membership for consideration around what they might be able to do if they choose to employ performance technology on their campus. Just some guidance statements, nothing that's going to be recommended or required, but things to think about if you're going to be slapping these straps and these bands and these GPS trackers on our athletes. Let's be mindful of what we're tracking and whether or not the technologies are doing what people are telling us they're doing. Are we really looking back and saying, was that useful? Did that help our athletes get better or keep them safer? And is this really where our financial resources should be towards rather than other things on campus? And then really importantly, it talks about making sure that the data that we're collecting is saved, stored, and accessed in a responsible way.
For those that maybe are hearing that for the first time, SSI Spotlight, what is it and how would you kind of describe it for a newcomer?
Sure. So our SSI Spotlight series is something we're really excited about. This is, you can call it like a lunchtime webinar series. The majority of our audience are athletic trainers and some team physicians. And what we do is we pick topics that the membership has expressed to us that they want more resources and more support around. And we have these webinars. I usually interview 1, 2, or 3 other panelists, and we just have a casual conversation about different topics. We highlight a lot of resources, not just NCAA resources, but resources that exist just in the general medical and scientific community. And it's a great way for athletic trainers or team doctors to tune in. If you listen to me on 1.5x, I sound a little bit like a chipmunk, but you can get through it all even in less time. And we just think it's a really helpful way to connect with our membership. And we're getting great feedback from it. Folks from the membership think that it's high quality and they think that it's actually impacting their work, which is good for us to hear.
Doctor, one of those focuses has been kind of more towards this health and safety issues that impact female student athletes. Where do you feel the focuses from your perspective are in that regard?
Yeah, CSMAS has signaled to us that this is an area that they sort of want to dive a little deeper into. We know generally in the scientific and medical community that research around female athletes specifically lags behind a little bit. And certainly with our membership, there are areas that student athletes say that they want more help around. When I think about surveys we've done for our student athletes and we ask them, what would you like people on your campus to be talking more about? 50% of our female student athletes say body image. So that is an area that CSMAS is very interested in diving into and doing a little bit more in terms of educational resources. But there's other areas like relative energy deficiency in sport, which honestly isn't just a female athlete thing. I think more research and more work in this area will also benefit our male athletes. And then other studies around ACL injuries in females. We're looking for ways to leverage our injury surveillance program data to sort of look in deeper to some of these female athlete specific issues.
You mentioned the body image. You know, when it comes to harassment online, you've got that aspect, and then also from the gambling side as well, and the badgering that fans will, kind of key in on. What are you working on when it comes to the harassment there, whether it's gambling or competition or body image?
Yeah, so we can talk a little bit about social media first. That's where I think about that body image piece. We have 30% of female athletes in our 2024 social environment survey said that they feel like social media makes them feel worse about their body, right? And that sort of falls in line with these other surveys where they say we want more help around this. So we know social media is playing a role here. Now, listen, there are lots of positives to social media, right? This is an area of connection for student athletes, especially our international student athletes. It's also an area now where athletes are building their brand, right, which is important. But it's also a platform where they see scrutiny, and there's mental health impacts to this. And so there are some positives. We're seeing athletes now sort of putting some things into place to limit their social media use. You may have heard in the news that Fernando Mendoza deleted all of his social media other than LinkedIn through the college football playoff, which I think is just a wonderful standard to set as other student athletes see that and hear that. But the harassment piece is a great question. This is obviously something that the NCAA has really doubled down on. Charlie Baker, obviously, this is a very important topic for him. We partnered with Signify last year's March Madness tournament and then the year after in 2025. And the good news is, after our educational campaign and a lot of work we've been doing to try to bring attention to this issue, we're actually seeing that that online harassment around sports betting and around general harassment comments as well have gone down since 2024. General sports betting harassment has gone down 23% in our last Signify study compared to the one in 2024. And then when we look at just general harassment in women, is down 83% online, and harassment against men down 140%. So it's not gone. It's still an issue that we need to tackle, but we do believe that our efforts and our educational campaign around this topic is starting to make a difference in the right direction. But athletes need to be careful, and there are resources available for athletes to guard against some of this. Signify and Moonshot are resources where student athletes can put social media monitoring programs at work to help protect them from some of this.
Well, doctor, those are great numbers. So hopefully
Yeah.
you can keep on moving in the right direction there. I want to pivot towards a little bit more of your past, because obviously you started your career in athletic training, and it's something that you have come out and spoken so outwardly against the disparities around the country from the different divisions. What are you doing to try to bring more attention to the support in that field?
Yeah, it's a great question. Thank you for bringing it up. I always try to talk about this issue whenever I can publicly. Yeah, athletic trainers are the lifeblood of athletics in the NCAA, right? We wouldn't be able to have NCAA competitions and NCAA championships if we didn't have athletic trainers. And this is coming from a team doctor, right? I took a lot of pride in my work, but I would be nothing without the athletic trainers beside me. So making sure that we are really tracking on why schools across all three divisions are having difficulty recruiting and retaining athletic trainers is a big deal. And it's an issue I talk to presidents and chancellors about, because obviously the worse this issue gets, right, more and more schools with open positions and not enough athletic trainers to support their athletes, then we start to introduce the possibilities of risk, right? And no school wants to put themselves in that position. And so what we've been trying to do at the national level is really gather stakeholders and bring all of the folks that really have an opportunity to make a difference together. We all have a common goal. We all want this to get better. So let's get in the same room and let's talk about what we can do. And so we've moved from talking about it to actually developing some actionable strategies around this. And our stakeholder groups are working on things like a white paper that summarizes different healthcare delivery models so schools can learn from what other schools are doing to tackle this problem. We're working on a fact sheet, which sort of just gathers the state of the union on one piece of paper and also gathers all of the existing resources around this topic, so our membership can go to one piece of paper and get all the resources that they need. We're working on team physician advocacy strategies and mentoring pipelines. And so we really hope that over the next couple of months, the membership will see some of these actionable items that these stakeholder groups are putting together. And hopefully we can start to chip away at this issue. We know it's complex. We know that the reasons for it are multifactorial. It's going to take culture change. athletic trainers are leaving the collegiate setting to work in places like Amazon and FedEx because they may pay better and their hours may be a little bit more palatable. And so we really have to get a hold of this before it gets out of hand.
Having kind of worked at different levels of the NCAA position myself, seeing the facility disparity is something that may factor in as well. Do you feel like there is an improvement that could be made at the smaller school level facility-wise to help kind of grow or draw people in from the athletic trainer side?
Yeah, I think it's less about the facilities and more about the ratio of athletic trainer to number of athletes to number of facilities, right? So if you're at a school that just has one sports building and all of your athletes are in that building, it might be easier for a smaller number of athletic trainers at a under-resourced school to take care of all of those athletes. But when you have one building over here and one building over here, and you only have one athletic trainer that has to rush around from building to building, that's where the disparities really become a little bit more evident. Important to remember that every school is different. The budgets are different, the campuses are laid out different, the number of sports they support and sponsor are different. And so just really important for every institution to look at themselves and say, what do we need to do to make our situation better for our athletic trainers so that they don't leave us for another school, or worse yet, Amazon or FedEx. No offense to Amazon or FedEx, but we don't want to give any more athletic trainers away to them.
Absolutely. Last question here. Having worked at the D3 level and then moved up to UConn at the D1 level, what did you take from that you can kind of put into this position here moving forward to try to maybe even the separation of resources or just overall medical differences between those levels?
Yeah, I'm really grateful that I had that diverse experience. Did my training at a D3 school, undergrad at a D3 school, and then obviously got to work at the D1 level. And then in between there, I worked at some lower level D1 schools as well. And I think seeing the difference in the resources, seeing the difference in the philosophies, right, between a D3 school that doesn't offer scholarships to their athletes and really has this sort of academic first approach versus UConn, which certainly did prioritize academics, but athletics was obviously a huge part of that. You learn different ways that the membership has to navigate challenges. And I think I'm just really grateful that I got to see both levels so that I can take that into our work and make sure that when we're putting forth recommendations or requirements to the membership, that we're keeping in mind that we're talking about 3 different divisions with various resources, various budgets, and it's just helpful to our work.
Well, Doctor, I look forward to seeing the continued growth of all of these key moments and checking out, more and more of what you are diving into this. Thank you so much for joining us.
Thank you so much for having me.